Hey, Alphanesses, I'm Licensure from AlphaNessGuy.com. This is 100 practice questions. Without the way, let's get started.
The nurse is admitting an older adult to the hospital. The echocardiogram report revealed left ventricular enlargement. The nurse notes 2+ pitting edema in the ankles when getting the client into bed. Based on this finding, what should the nurse do first? 1. Assess respiratory status. 2. Draw blood for laboratory studies. 3. Insert Foley catheter. 4. Weigh the client. The correct answer is 1. The ankle edema suggests fluid volume overload. The nurse should assess respiratory rate, lung sounds, and SpO2 to identify any signs of respiratory symptoms of heart failure requiring immediate attention. The nurse can then draw blood for laboratory studies, insert the Foley catheter, and weigh the client. A client receiving a loop diuretic should be encouraged to eat which of the following foods? Select all that apply. 1. Angel food cake. 2. Banana. 3. Dried fruit. 4. Orange juice. 5. Peppers. The correct answers are 2, 3, and 4. Hypokalemia is a side effect of loop diuretics. Bananas, dried fruit, and oranges are examples of food high in potassium. Angel food cake, yellow cake, and peppers are low in potassium. The nurse should assess the client for digoxin toxicity if serum levels indicate that the client has a 1. Low sodium level. 2. High glucose level. 3. High calcium level. 4. Low potassium level. The correct answer is 4. A low serum potassium level predisposes the client to digoxin toxicity. Because potassium inhibits cardiac excitability, a low serum potassium level would mean that the client will be prone to increased cardiac excitability. Sodium, glucose, and calcium levels do not affect digoxin or contribute to digoxin toxicity. The nurse teaches a client with heart failure to take oral furosemide in the morning. The primary reason for this is to help 1. Prevent electrolyte imbalances. 2. Slow rapid drug absorption. 3. Excrete excessive fluids accumulated during the night. 4. Prevent sleep disturbances during the night. The correct answer is 4. When diuretics are given early in the day, the client will void frequently during the daytime hours and will not need to void frequently during the night. Therefore, the client's sleep will not be disturbed. Taking furosemide in the morning has no effect on preventing electrolyte imbalances or slowing rapid drug absorption. The client should not accumulate excessive fluids throughout the night. A client with heart failure is receiving digoxin intravenously. The nurse should determine the effectiveness of the drug by assessing which of the following? 1. Dilated coronary arteries. 2. Increased myocardial contractility. 3. Decreased cardiac arrhythmias. 4. Decreased electrical conductivity in the heart. The correct answer is 2. Digoxin is a cardiac glycoside with positive inotropic activity. This inotropic activity causes increased strength of myocardial contractions and thereby increases output of blood from the left ventricle. Digoxin does not dilate coronary arteries. Although digoxin can be used to treat arrhythmias and does decrease the electrical conductivity of the myocardium, these are not primary reasons for its use in clients with heart failure and pulmonary edema. In which of the following positions should the nurse place a client with heart failure who has orthopnea? 1. Semi-sitting low Fowler position with legs elevated on pillows. 2. Lie on the right side, Sims position, with a pillow between the legs. 3. Sitting upright, high Fowler position, with legs resting on the mattress. 4. Lying on the back with the head lowered, Trendelenburg position, and legs elevated. The correct answer is 3. Sitting almost upright in bed with the feet and legs resting on the mattress decreases venous return to the heart, thus reducing myocardial workload. Also, the sitting position allows maximum space for lung expansion. Low Fowler's position would be used if the client could not tolerate high Fowler's position for some reason. Lie on the right side would not be a good position for the client in heart failure. The client in heart failure would not tolerate Trendelenburg's position. The nurse is assessing a client with chronic heart failure who is demonstrating neurohormonal compensatory mechanisms. Which of the following are expected findings on assessment? Select all that apply. 1. Decreased cardiac output. 2. Increased heart rate. 3. Vasoconstriction in skin, GI tract, and kidneys. 4. Decreased pulmonary perfusion. 5. Fluid overload. The correct answers are 1, 2, 3, and 5. Heart failure can be a result of several cardiovascular conditions, which will affect the heart's ability to pump effectively. The body attempts to compensate through several neurohormonal mechanisms. Decreased cardiac output stimulates the aortic and carotid baroreceptors, which activates the sympathetic nervous system to release norepinephrine and epinephrine. This early response increases the heart rate and contractility. It also has some negative effects, including vasoconstriction of the skin, GI tract, and kidneys. Decreased renal perfusion due to low CO and vasoconstriction activates the renin-angiotensin-aldosterone process, resulting in the release of antidiuretic hormone. This causes fluid retention in an attempt to increase blood pressure, therefore cardiac output. In the damaged heart, this causes fluid overload. There is no parasympathetic response. Decreased pulmonary perfusion can be a result of fluid overload or concomitant pulmonary disease. Which of the following sets of conditions is an indication that a client with a history of left side heart failure is developing pulmonary edema? Select all that apply. 1. Distended jugular veins. 2. Dependent edema. 3. Anorexia. 4. Coarse crackles. 5. Tachycardia. The correct answers are 4 and 5. Signs of pulmonary edema are identical to those of acute heart failure. Signs and symptoms are generally apparent in the respiratory system and include coarse crackles, severe dyspnea, and tachypnea. Severe tachycardia occurs due to sympathetic stimulation in the presence of hypoxemia. Blood pressure may be decreased or elevated, depending on the severity of the edema. Jugular vein distension, dependent edema, and anorexia are symptoms of right-sided heart failure. A client has a history of heart failure and has been taking furosemide, Lasix, digoxin, Lanoxin, and potassium chloride. The client has nausea, blurred vision, headache, and weakness. The nurse notes that the client is confused. The telemetry strip shows first-degree atrioventricular block. The nurse should assess the client for signs of which of the following? 1. Hyperkalemia. 2. Digoxin toxicity. 3. Fluid deficit. 4. Pulmonary edema. The correct answer is 2. Early symptoms of digoxin toxicity include anorexia, nausea, and vomiting. Visual disturbances can also occur, including double or blurred vision and visual halos. Hypokalemia is a common cause of digoxin toxicity associated with arrhythmias because low serum potassium can enhance ectopic pacemaker activity. Although vomiting can lead to fluid deficit, given the client's history, the vomiting is likely due to the adverse effects of digoxin toxicity. Pulmonary edema is manifested by dyspnea and coughing. When teaching a client with heart failure about preventing complications and future hospitalizations, which problems stated by the client as reasons to call a physician would indicate to the nurse that the client has understood the teaching. Select all that apply. 1. Becoming increasingly short of breath at rest. 2. Weight gain of 2 pounds or more in one day. 3. High intake of sodium for breakfast. 4. Having to sleep sitting up in a reclining chair. 5. Weight loss of 2 pounds in one day. The correct answers are 1, 2, and 4. If the client will call the physician when there is increasing shortness of breath, weight gain over 2 pounds in one day, and need to sleep sitting up, this indicates an understanding of the teaching, because these signs and symptoms suggest worsening of the client's heart failure. Although the client will most likely be placed on a sodium-restricted diet, the client would not need to notify the physician if he or she had consumed a high-sodium breakfast. Instead, the client would need to be alert for possible signs and symptoms of worsening heart failure and work to reduce sodium intake for the rest of that day and in the future. The nurse's discharge teaching plan for the client with heart failure should emphasize the importance of doing which of the following? 1. Maintaining a high-fiber diet. 2. Walking 2 miles every day. 3. Obtaining daily weights at the same time each day. 4. Remaining sedentary for most of the day. The correct answer is 3. Instructing the client to obtain daily weights at the same time each day is very important. The client should be told to call the physician if there has been a weight gain of 2 pounds or more. This may indicate fluid overload, and treatment can be prescribed early and on an outpatient basis, rather than waiting until the symptoms become life-threatening. Following a high-fiber diet is beneficial, but it is not relevant to the teaching needs of the client with heart failure. Prescribing an exercise program for the client, such as walking 2 miles every day, would not be appropriate at discharge. The client's exercise program would need to be planned in consultation with the physician and based on the history and the physical condition of the client. The client may require exercise tolerance testing before an exercise plan is laid out. Although the nurse does not prescribe an exercise program for the client, a sedentary lifestyle should not be recommended. When assessing an older adult, the nurse finds the apical impulse below the 5th intercostal space. The nurse should further assess the client for 1. Left atrial enlargement. 2. Left ventricular enlargement. 3. Right atrial enlargement. 4. Right ventricular enlargement. The correct answer is 2. A normal apical impulse is found over the apex of the heart and is typically located and auscultated in the left 5th intercostal space in the midclavicular line. An apical impulse located or auscultated below the 5th intercostal space or lateral to the midclavicular line may indicate left ventricular enlargement. Which of the following foods should the nurse teach a client with heart failure to limit when following a 2-gram sodium diet? 1. Apples. 2. Tomato juice. 3. Whole wheat bread. 4. Beef tenderloin. The correct answer is 2. Canned foods and juices, such as tomato juice, are typically high in sodium and should be avoided in a sodium-restricted diet. Canned foods and juices in which sodium has been removed or limited are available. The client should be taught to read labels carefully. Apples and whole wheat breads are not high in sodium. Beef tenderloin would have less sodium than canned foods or tomato juice. The nurse should teach the client that signs of digoxin toxicity include which of the following? 1. Rash over the chest and back. 2. Increased appetite. 3. Visual disturbances, such as seeing yellow spots. 4. Elevated blood pressure. The correct answer is 3. Colored vision and seeing yellow spots are symptoms of digoxin toxicity. Abdominal pain, anorexia, nausea, and vomiting are other common symptoms of digoxin toxicity. Additional signs of toxicity include arrhythmias, such as atrial fibrillation or bradycardia. Rash, increased appetite, and elevated blood pressure are not associated with digoxin toxicity. Furosemide is administered intravenously to a client with heart failure. How soon after administration should the nurse begin to see evidence of the drug's desired effect? 1. 5 to 10 minutes. 2. 30 to 60 minutes. 3. 2 to 4 hours. 4. 6 to 8 hours. The correct answer is 1. After intravenous injection of furosemide, diuresis normally begins in about 5 minutes and reaches its peak within about 30 minutes. Medication effects last 2 to 4 hours. When furosemide is given intramuscularly or orally, drug action begins more slowly and lasts longer than when it is given intravenously. The major goal of nursing care for a client with heart failure and pulmonary edema is to 1. Increase cardiac output. 2. Improve respiratory status. 3. Decrease peripheral edema. 4. Enhance comfort. The correct answer is 1. Increasing cardiac output is the main goal of therapy for the client with heart failure or pulmonary edema. Pulmonary edema is an acute medical emergency requiring immediate intervention. Respiratory status and comfort will be improved when cardiac output increases to an acceptable level. Peripheral edema is not typically associated with pulmonary edema. Lasix, 40 milligrams intravenous push, is prescribed. Lasix 10 milligrams per 1 milliliter is available. The nurse should administer blank ml. The correct answer is 4 milliliters. The formula is desired amount divided by what is available, times quantity equals to amount to administer. 40 divided by 10 and multiplied by 1 equals to 4 milliliters. An older adult with a history of heart failure is admitted to the emergency department with pulmonary edema. On admission, which of the following should the nurse assess first? 1. Blood pressure. 2. Skin breakdown. 3. Serum potassium level. 4. Urine output. The correct answer is 1. It is a priority to assess blood pressure first because people with pulmonary edema typically experience severe hypertension that requires early intervention. The client probably does not have skin breakdown, but when the client is stable and when the nurse obtains complete health history, the nurse should inspect the client's skin for any signs of breakdown. However, when the client is stable, the nurse should inspect the skin. Potassium levels are not the first priority. The nurse should monitor urine output after the client is stable. The nurse should assess the client with left-sided heart failure, for which the following? Select all that apply. 1. Dyspnea. 2. Jugular vein distension. 3. Crackles. 4. Right upper quadrant pain. 5. Oliguria. 6. Decreased oxygen saturation levels. The correct answers are 1, 3, 5, and 6. Dyspnea, crackles, oliguria, and decreased oxygen saturation are signs and symptoms related to pulmonary congestion and inadequate tissue perfusion associated with left-sided heart failure. JVD and right upper quadrant pain, along with ascites and edema, are usually associated with congestion of the peripheral tissues and viscera in right-sided heart failure. A client with chronic heart failure has atrial fibrillation and a left ventricular ejection fraction of 15%. The client is taking warfarin, Coumadin. The expected outcome of this drug is to 1. Decrease circulatory overload. 2. Improve the myocardial workload. 3. Prevent thrombus formation. 4. Regulate cardiac rhythm. The correct answer is 3. Coumadin is an anticoagulant, which is used in the treatment of atrial fibrillation and decreased left ventricular ejection fraction, less than 20%, to prevent thrombus formation and release of emboli into the circulation. The client may also take other medication as needed to manage the heart failure. Coumadin does not reduce circulatory load or improve myocardial workload. Coumadin does not affect cardiac rhythm. Before a client's discharge after mitral valve replacement surgery, the nurse should evaluate the client's understanding of post-surgery activity restrictions, which are following should the client not engage in until after the 1-month post-discharge appointment with the surgeon. 1. Showering. 2. Lifting anything heavier than 10 pounds. 3. A program of gradually progressive walking. 4. Light housework. The correct answer is 2. Most cardiac surgical clients have median sternotomy incisions, which take about 3 months to heal. Measures that promote healing include avoiding heavy lifting, performing muscle reconditioning exercises, and using caution when driving. Showering or bathing is allowed as long as the incision is well approximated with no open areas or drainage. Activities should be gradually resumed on discharge. The nurse should teach the client who is receiving warfarin sodium that 1. Partial thromboplastin time values determine the dosage of warfarin sodium. 2. Protamine sulfate is used to reverse the effects of warfarin sodium. 3. International normalized ratio is used to assess effectiveness. 4. Warfarin sodium will facilitate clotting of the blood. The correct answer is 3. INR is a value used to assess effectiveness of the warfarin sodium therapy. Partial thromboplastin time is used to assess the effectiveness of heparin therapy. Fresh frozen plasma or vitamin K is used to reverse warfarin sodium's anticoagulant effect, whereas protamine sulfate reverses the effects of heparin. Warfarin sodium will help to prevent blood clots. The most effective measure the nurse can use to prevent wound infection when changing a client's dressing after coronary artery bypass surgery is to 1. Observe careful hand washing procedures. 2. Clean the incisional area with an antiseptic. 3. Use pre-packaged sterile dressings to cover the incision. 4. Place soil dressings in a waterproof bag before disposing of them. The correct answer is 1. Many factors help prevent wound infections, including washing hands carefully, using sterile pre-packaged supplies and equipment, cleaning the incisional area well, and disposing of soil dressings properly. However, most authorities say that the single most effective measure in preventing wound infections is to wash the hands carefully before and after changing dressings. Careful hand washing is also important in reducing other infections often acquired in hospitals, such as urinary tract and respiratory tract infections. In preparing the client and the family for a postoperative stay in the intensive care unit after open heart surgery, the nurse should explain that 1. The client will remain in the ICU for 5 days. 2. The client will sleep most of the time while in the ICU. 3. Noise and activity within the ICU are minimal. 4. The client will receive medication to relieve pain. The correct answer is 4. Management of postoperative pain is a priority for the client after surgery, including valve replacement surgery. The client and family should be informed that pain will be assessed by the nurse and medications will be given to relieve the pain. The client will stay in the ICU as long as monitoring and intensive care are needed. Sensory deprivation and overload, high noise levels, and disrupted sleep and rest patterns are some environmental factors that affect recovery from valve replacement surgery. A pulmonary artery catheter is inserted in a client with severe mitral stenosis and regurgitation. The nurse administers furosemide, Lasix, to treat pulmonary congestion and begins a nitroprusside, nipride, drip per physician prescriptions. The nurse notices a sudden drop in the pulmonary artery diastolic pressure and pulmonary artery wedge pressure. The nurse should first assess 1. 12-lead EKG. 2. Blood pressure. 3. Lung sounds. 4. Urine output. The correct answer is 2. The nurse should immediately assess the blood pressure since nipride and Lasix can cause severe hypotension from a decrease in preload and afterload. If the client is hypotensive, the nipride dose should be reduced or discontinued. Urine output should then be monitored to make sure there is adequate renal perfusion. A 12-lead EKG is performed if the client experiences chest pain. A reduction in pulmonary artery pressures should improve the pulmonary congestion and lung sounds. Which is the most important initial post-procedure nursing assessment for a client who has had a cardiac catheterization? 1. Monitor the laboratory values. 2. Observe neurologic function every 15 minutes. 3. Observe the puncture site for swelling and bleeding. 4. Monitor skin warmth and turgor. The correct answer is 3. Assessment of circulatory status, including observation of the puncture site, is of primary importance after a cardiac catheterization. Laboratory values and skin warmth and turgor are important to monitor, but are not the most important initial nursing assessment. Neurologic assessment every 15 minutes is not required. A client with aortic stenosis has increasing dyspnea and dizziness. Identify the area where the nurse would place the stethoscope to assess a murmur from aortic stenosis. Choose option 1, 2, 3, 4, or 5 from the picture. The correct answer is option 1. The stethoscope is placed at the second intercostal space right of sternum to assess the aortic area as seen in option 1. Option 2 is a pulmonic valve area. Option 3 is Erb's point. Option 4 is a tricuspid valve area. And option 5 is the mitral valve area. A client has returned from the cardiac catheterization laboratory after a balloon valvuloplasty for mitral stenosis. Which of the following requires immediate nursing action? 1. A low, grade 1 intensity mitral regurgitation murmur. 2. SpO2 is 94% on 2 liters of oxygen via nasal cannula. 3. The client has become more somnolent. 4. Urine output has decreased from 60 milliliters per hour to 40 milliliters over the last hour. The correct answer is 3. A complication of balloon valvuloplasty is emboli resulting in a stroke. The client's increased drowsiness should be evaluated. Some degree of mitral regurgitation is common after the procedure. The oxygen status and urine output should be monitored closely, but do not warrant concern. 3 days after mitral valve replacement surgery, the client tells a nurse there is a clicking noise coming from the chest incision, and the incision seems to be becoming larger. The nurse's response should reflect the understanding that the client may be experiencing which of the following? 1. Anxiety related to altered body image. 2. Anxiety related to altered health status. 3. Altered tissue perfusion. 4. Lack of knowledge regarding the postoperative course. The correct answer is 1. Verbalized concerns from this client may stem from anxiety over the changes in the body after open heart surgery. Although the client may experience anxiety related to altered health status or may have a lack of knowledge regarding the postoperative course, the client is pointing out the changes in the body image. The client is not concerned about altered tissue perfusion. Good dental care is an important measure in reducing the risk of endocarditis. A teaching plan to promote good dental care in a client with mitral stenosis should include instructing the client to do which of the following? Select all that apply. 1. Brush the teeth at least twice a day. 2. Avoid use of an electric toothbrush. 3. Take an antibiotic prior to oral surgery. 4. Floss the teeth at least once a day. 5. Have regular dental checkups. 6. Rinse the mouth with an antibiotic mouthwash once a day. The correct answers are 1, 4, and 5. Daily dental care, including brushing the teeth twice a day and flossing once a day and frequent checkups by a dentist who is informed about the client's condition, are required to maintain good oral health. The client can use a regular toothbrush. It is not necessary to avoid use of an electric toothbrush. Taking antibiotics prior to certain dental procedures is recommended only if the client has a prosthetic valve or a heart transplant. It is not necessary to use an antibiotic mouthwash. For a client who excretes excessive amounts of calcium during the postoperative period after open heart surgery, which of the following measures should the nurse institute to help prevent complications associated with excessive calcium excretion? 1. Ensure a liberal fluid intake. 2. Provide an alkaline ash diet. 3. Prevent constipation. 4. Enrich the client's diet with dairy products. The correct answer is 1. In an immobilized client, calcium leaves the bone and concentrates in the extracellular fluid. When a large amount of calcium passes through the kidneys, calcium can precipitate and form calculi. Nursing interventions that help prevent calculi include ensuring a liberal fluid intake, unless contraindicated. A diet rich in acid should be provided to keep the urine acidic, which increases the solubility of calcium. Preventing constipation is not associated with excessive calcium excretion. Limiting foods rich in calcium, such as dairy products, will help in preventing renal calculi. A client who has undergone a mitral valve replacement has persistent bleeding from the sternal incision during the early postoperative period. The nurse should do which of the following? Select all that apply. 1. Administer warfarin. 2. Check the postoperative CBC, INR, PTT, and platelet levels. 3. Confirm availability of blood products. 4. Monitor the mediastinal chest tube drainage. 5. Start a dopamine drip for a systolic BP less than 100. The correct answers are 2, 3, and 4. The hemoglobin and hematocrit should be assessed to evaluate blood loss. An elevated INR and PTT and decreased platelet count increase the risk for bleeding. The client may require blood product depending on lab values and severity of bleeding. Therefore, availability of blood products should be confirmed by calling the blood bank. Close monitoring of blood loss from the mediastinal chest tubes should be done. Warfarin is an anticoagulant that will increase bleeding. Anticoagulation should be held at this time. Information is needed on the type of valve replacement. For mechanical heart valve, The INR is kept at 2 to 3.5. Tissue valves do not require anticoagulation. Dopamine should not be initiated if the client is hypotensive from hypovolemia. Fluid volume assessment should always be done first. Volume replacement should be initiated in a hypovolemic client prior to starting an inotrope, such as dopamine. A client has mitral stenosis and will have a valve replacement. The nurse is instructing the client about health maintenance prior to surgery. Inability to follow which of the following regimens would pose the greatest health hazard to this client at this time? 1. Medication therapy. 2. Diet modification. 3. Activity restrictions. 4. Dental care. The correct answer is 1. Preoperatively, anticoagulants may be prescribed for client with advanced valvular heart disease to prevent emboli. Postoperatively, all clients with mechanical valves and some clients with bioprosthesis are maintained indefinitely on anticoagulant therapy. Adhering strictly to a dosage schedule and observing specific precautions are necessary to prevent hemorrhage or thromboembolism. Some clients are maintained on lifelong antibiotic prophylaxis to prevent recurrence of rheumatic fever. Episodic prophylaxis is required to prevent infective endocarditis after dental procedures or upper respiratory, gastrointestinal, or genitourinary tract surgery. Diet modification, activity restrictions, and dental care are important. However, they do not have as much significance postoperatively as medication therapy does. A client experiences initial indications of excitation after having an IV infusion of lidocaine hydrochloride started. The nurse should further assess the client when the client reports having 1. Palpitations. 2. Tinnitus. 3. Urinary frequency. 4. Lethargy. The correct answer is 2. Common adverse effects of lidocaine hydrochloride include dizziness, tinnitus, blurred vision, tremors, numbness and tingling of extremities, excessive perspiration, hypotension, seizures, and finally coma. Cardiac effects include slow conduction and cardiac arrest. Palpitations, urinary frequency, and lethargy are not considered typical adverse reactions to lidocaine. A client is scheduled for a cardiac catheterization. The nurse should do which of the following pre-procedure tasks? Select all that apply. 1. Administer all prescribed oral medications. 2. Check for iodine sensitivity. 3. Verify that written consent has been obtained. 4. Withhold food and oral fluids before the procedure. 5. Insert a urinary drainage catheter. The correct answers are 2, 3, and 4. For clients scheduled for a cardiac catheterization, it is important to assess for iodine sensitivity, verify written consent, and instruct the client to take nothing by mouth for 6 to 18 hours before the procedure. Oral medications are withheld unless specifically prescribed. A urinary drainage catheter is rarely required for this procedure. An elderly client with diabetes who has been maintained on metformin glucophage has been scheduled for a cardiac catheterization. The nurse should verify that the physician has written a prescription to 1. Limit the amount of protein in the diet prior to the cardiac cath. 2. Withhold the glucophage prior to the cardiac catheterization. 3. Administer the glucophage with only a sip of water prior to the cardiac catheterization. 4. Give the glucophage before breakfast. The correct answer is 2. The nurse should verify that the physician has requested to withhold the glucophage prior to any procedure requiring dye, such as a cardiac catheterization, due to increased risk of lactic acidosis. Additionally, the drug will usually be withheld for up to 48 hours following a procedure involving dye, while it clears the client's system. The physician may prescribe sliding scale insulin during this time if needed. Regardless of how or when the medication is administered, the medication should be withheld. The amount of protein in the client's diet prior to the cardiac catheterization has no correlation with the medication or the test. Which of the following home care instructions would be appropriate for a client with a laryngectomy? 1. Perform mouth care every morning and evening. 2. Provide adequate humidity in the home. 3. Maintain a soft, bland diet. 4. Limit physical activity to shoulder and neck exercises. The correct answer is 2. Adequate humidity should be provided in the home to help keep secretions moist. A bedside humidifier is recommended. A high fluid intake is also important to liquefy secretions. Mouth care is important to prevent drying of mucous membranes and should be performed frequently throughout the day, especially before and after meals, to help stimulate appetite. The client may eat any food that can be chewed and swallowed comfortably. The client may resume physical activity as tolerated. A client has just returned from the post-anesthesia care unit after undergoing a laryngectomy. Which of the following interventions should the nurse include in the plan of care? 1. Maintain the head of the bed at 30 to 40 degrees. 2. Teach the client how to use esophageal speech. 3. Initiate small feedings of soft foods. 4. Irrigate drainage tubes as needed. The correct answer is 1. Immediately after surgery, the client should be maintained in position with the head of the bed elevated 30 to 40 degrees to decrease tissue edema, facilitate breathing, and decrease pain related to edema formation. Immediately post-operatively, the client should be provided alternative means of communicating, such as a communication board. As healing progresses and edema subsides, a speech therapist should work with the client to explore various voice restoration options, such as the use of a voice prosthesis, electrolarynx, artificial larynx, or esophageal speech. Food is not initiated in the immediate postoperative phase. Enteral feedings are usually used to meet nutritional needs until edema subsides. Irrigation of the drainage tubes is an inappropriate action. What areas of education should the nurse provide employees in a factory making products that cause respiratory irritation to reduce the risk of laryngeal cancer? Select all that apply. 1. Stopping smoking. 2. Using a HEPA filter in the home. 3. Limiting alcohol intake. 4. Brushing teeth after every meal. 5. Avoiding raising the voice to be heard over the noise in a factory. The correct answers are 1 and 3. The primary risk factors for laryngeal cancer are smoking and alcohol intake. Smoking cessation is most successful with a support group or counseling. Heavy drinking should be avoided since the risk increases with the amount of alcohol consumption. HEPA filters help trap small particles and allergens to reduce allergy symptoms and asthma. Poor oral hygiene is not a risk factor, nor is overusing the voice. The client with a laryngectomy does not want his family to see him. He indicates that he thinks the opening in his throat is disgusting. The nurse should 1. Initiate teaching about the care of a stoma. 2. Explain that the stoma will not always look as it does now. 3. Inform the client of the benefits of family support at this time. 4. Explore why the client believes the stoma is disgusting. The correct answer is 4. Changes in body image are expected after laryngectomy, and the nurse should first explore what is upsetting the client the most at this time. Many clients are concerned about how their family members will respond to the physical changes that have occurred as a result of a laryngectomy, but discussing the importance of family support is not helpful. Instead, the nurse should allow the client to communicate any negative feelings or concerns that exist because of the surgery. The client's feelings are not related to a knowledge deficit, and therefore, it is too early to begin teaching about stoma care. It is also not helpful to offer reassurances about the change in appearance. The client will require time to adjust to the changed body image. The nurse is suctioning a client who had a laryngectomy. What is the maximum amount of time the nurse should suction the client? 1. 10 seconds. 2. 30 seconds. 3. 45 seconds. 4. 60 seconds. The correct answer is 1. A client should be suctioned for no longer than 10 seconds at a time. Suctioning for longer than 10 seconds may reduce the client's oxygen levels so much that he becomes hypoxic. Postoperative nursing management of the client following a radical neck dissection for laryngeal cancer requires 1. Complete bed rest minimizing head movement. 2. Vital signs once a shift. 3. Clear liquid diet started at 48 hours. 4. Frequent suctioning of the laryngectomy tube. The correct answer is 4. The nurse must maintain patency of the airway with frequent suctioning of the laryngectomy tube that can become occluded from secretions, blood, and mucus plugs. Once the client is hemodynamically stable, getting out of bed should be encouraged to prevent postoperative complications. Vital signs should be monitored more frequently in a postoperative client. A swallow study is done at approximately 5 to 7 days after surgery, prior to starting oral intake. The nurse's assignment consists of 4 clients. Prioritize in order from highest to lowest priority in what order the nurse would assess these clients after receiving report. 1. An 85-year-old client with bacterial pneumonia, temperature of 102.2 degrees Fahrenheit, and shortness of breath. 2. A 60-year-old client with chest tubes who is postoperative for 2 days following a thoracotomy for lung cancer and is requesting something for pain. 3. A 35-year-old client with suspected tuberculosis who has a cough. 4. A 56-year-old client with emphysema who has a scheduled dose of a bronchodilator due to be administered, with no report of acute respiratory distress. The correct order is 1, 2, 4, and 3. The elderly client with pneumonia, an elevated temperature, and shortness of breath is the most acutely ill client described and should be the client with the highest priority. The elevated temperature and the shortness of breath can lead to a decrease in the client's oxygen levels and can predispose the client to dehydration and confusion. Then the nurse should assess the client with a thoracotomy who is requesting pain medication and administer any needed medication. The client with emphysema should be the next priority so that the bronchodilator can be administered on schedule as close as possible. The nurse would then assess the client with suspected tuberculosis and a cough. Which of the following is an expected outcome for a client recovering from a total laryngectomy? The client will 1. Regain the ability to taste and smell food. 2. Demonstrate appropriate care of the gastrostomy tube. 3. Communicate feelings about body image changes. 4. Demonstrate sterile suctioning technique for stomach care. The correct answer is 3. It is important that the client be able to communicate his or her feelings about the body image changes that have occurred as a result of surgery. Open communication helps promote adjustment. The client may not regain the ability to taste and smell food because of no longer breathing through the nose, or because of radiation therapy treatments, or both. A gastrostomy tube would not typically be placed after a total laryngectomy, nor would it be necessary for the client to demonstrate sterile suctioning technique for stomach care. The client would use clean technique. A client has had hoarseness for more than 2 weeks. The nurse should 1. Refer the client to a healthcare provider for a prescription for an antibiotic. 2. Instruct the client to gargle with salt water at home. 3. Assess the client for dysphagia. 4. Instruct the client to take a throat analgesic. The correct answer is 3. Hoarseness occurring longer than 2 weeks is a warning sign of laryngeal cancer. The nurse should first assess other signs, such as a lump in the neck or throat, persistent sore throat or cough, earache, pain, and difficulty swallowing. Gargling with salt water may lead to increased irritation. There is no indication of infection warranting an antibiotic. An oral analgesic will provide only temporary relief of discomfort if hoarseness is accompanied by a sore throat. The nurse is making rounds and observes a client who had a tracheostomy tube inserted 2 days ago. See figure below. The nursing policy manual recommends use of the gauze pad. The nurse should 1. Make sure the gauze pad is dry and the client is in a comfortable position. 2. Reposition the gauze pad around the stoma with the open end downward. 3. Ask a registered nurse to change the ties and position another gauze pad around the stoma. 4. Ask the nursing assistant to tie the tracheostomy tube ties in the back of the client's neck. The correct answer is 1. The tracheostomy tube, ties, and gauze pad are positioned correctly. The nurse should be sure the client is comfortable. The tracheostomy tube ties should be tied in a square knot on the side of the neck and alternate sides of the neck when the ties are changed. The full part of the gauze square should be placed under the tracheostomy tube to absorb drainage. There is no indication the ties need to be changed. An additional gauze pad is not necessary. If necessary, the current gauze square should be changed rather than add an additional pad. When suctioning a tracheostomy tube 3 days following insertion, the nurse should follow which of the following procedures. 1. Use a sterile catheter each time the client is suctioned. 2. Clean the catheter in sterile water after each use and reuse for no longer than 8 hours. 3. Protect the catheter in sterile packaging between suctioning episodes. 4. Use a clean catheter with each suctioning and disinfect it in hydrogen peroxide between uses. The correct answer is 1. The recommended technique is to use a sterile catheter each time the client is suctioned. There is a danger of introducing organisms into the respiratory tract when strict aseptic technique is not used. Reusing a suction catheter is not consistent with aseptic technique. The nurse does not use a clean catheter when suctioning a tracheostomy or a laryngectomy. It is a sterile procedure. A client who has had a total laryngectomy appears withdrawn and depressed. The client keeps the curtain drawn, refuses visitors, and indicates a desire to be left alone. Which nursing intervention would most likely be therapeutic for the client? 1. Discussing behavior with the spouse to determine the cause. 2. Exploring future plans. 3. Respecting the need for privacy. 4. Encouraging expression of feelings nonverbally and in writing. The correct answer is 4. The client has undergone body changes and permanent loss of verbal communication. He may feel isolated and insecure. The nurse can encourage him to express his feelings and use this information to develop an appropriate plan of care. Discussing the client behavior with his wife may not reveal his feelings. Exploring future plans is not appropriate at this time because more information about the client's behavior is needed before proceeding to this level. The nurse can respect the client's need for privacy while also encouraging him to express his feelings. The unlicensed assistive personnel reports to the nurse that a client admitted with pneumonia is very diaphoretic. The nurse reviews the following vital signs in the chart obtained by the UAP. The nurse should do which of the following? Select all that apply. 1. Assure the client is maintaining complete bed rest. 2. Check the urine output. 3. Ask the client to drink more fluids. 4. Notify the physician. 5. Administer acetaminophen as prescribed. Pause the video if needed and look at the chart. The correct answers are 2, 3, and 5. A client with pneumonia experiencing diaphoresis is at risk for dehydration and increased temperature and heart rate. The fluid status intake and urine output should be monitored closely. The client is febrile, causing increase in heart rate. Fluid volume deficit may also increase the heart rate. The underlying cause of the tachycardia can be treated with acetaminophen and increased intake of fluids. Bed rest limits lung expansion, and sitting up and deep breathing should be encouraged in a client with pneumonia. The blood pressure is stable enough to allow the client to get out of bed to the chair, with assistance to ensure safety. It is not necessary to notify the physician. Which of the following mental status changes may occur when a client with pneumonia is first experiencing hypoxia? 1. Coma. 2. Apathy. 3. Irritability. 4. Depression. The correct answer is 3. Clients who are experiencing hypoxia characteristically exhibit irritability, restlessness, or anxiety as initial mental status changes. As the hypoxia becomes more pronounced, the client may become confused and combative. Coma is a late clinical manifestation of hypoxia. Apathy and depression are not symptoms of hypoxia. Which of the following measures would most likely be successful in reducing pleuritic chest pain in a client with pneumonia? 1. Encourage the client to breathe shallowly. 2. Have the client practice abdominal breathing. 3. Offer the client incentive spirometry. 4. Teach the client to splint the rib cage when coughing. The correct answer is 4. The pleuritic pain is triggered by chest movement and is particularly severe during coughing. Splinting the chest wall will help reduce the discomfort of coughing. Deep breathing is essential to prevent further atelectasis. Abdominal breathing is not as effective in decreasing pleuritic chest pain as a splinting of the rib cage. Incentive spirometry facilitates effective deep breathing, but does not decrease pleuritic chest pain. The cyanosis that accompanies bacterial pneumonia is primarily caused by which of the following? 1. Decreased cardiac output. 2. Pleural effusion. 3. Inadequate peripheral circulation. 4. Decreased oxygenation of the blood. The correct answer is 4. A client with pneumonia has less lung surface available for the diffusion of gases because of the inflammatory pulmonary response that creates lung exudate and results in reduced oxygenation of the blood. The client becomes cyanotic because blood is not adequately oxygenated in the lungs before it enters the peripheral circulation. Decreased cardiac output may be a comorbid condition in some clients with pneumonia. However, it is not the cause of cyanosis. Pleural effusions are a potential complication of pneumonia, but are not the primary cause of decreased oxygenation. Inadequate peripheral circulation is also not the cause of the cyanosis that develops with bacterial pneumonia. A client with pneumonia has a temperature of 102.6 degrees Fahrenheit, is diaphoretic, and has a productive cough. The nurse should include which of the following measures in the plan of care? 1. Position changes every 4 hours. 2. Nasotracheal suctioning to clear secretions. 3. Frequent linen changes. 4. Frequent offering of a bedpan. The correct answer is 3. Frequent linen changes are appropriate for this client because of the diaphoresis. Diaphoresis produces general discomfort. The client should be kept dry to promote comfort. Position changes need to be done every 2 hours. Nasotracheal suctioning is not indicated with the client's productive cough. Frequent offering of a bedpan is not indicated by the data provided in this scenario. When caring for the client who is receiving an aminoglycoside antibiotic, the nurse should monitor which of the following laboratory values. 1. Serum sodium. 2. Serum potassium. 3. Serum creatinine. 4. Serum calcium. The correct answer is 3. It is essential to monitor serum creatinine in the client receiving an aminoglycoside antibiotic because of the potential of this type of drug to cause acute tubular necrosis. Aminoglycoside antibiotics do not affect serum sodium, potassium, or calcium levels. Which of the following are significant data to gather from a client who has been diagnosed with pneumonia? Select all that apply. 1. Quality of breath sounds. 2. Presence of bowel sounds. 3. Occurrence of chest pain. 4. Amount of peripheral edema. 5. Colored nail beds. The correct answers are 1, 3, and 5. A respiratory assessment, which includes auscultating breath sounds and assessing the color of the nail beds, is a priority for clients with pneumonia. Assessing for the presence of chest pain is also an important respiratory assessment, as chest pain can interfere with the client's ability to breathe deeply. Auscultating bowel sounds and assessing for peripheral edema may be appropriate assessments, but these are not priority assessments for a client with pneumonia. An elderly client admitted with pneumonia and dementia has attempted several times to pull out the IV and Foley catheter. The nurse obtains a prescription for bilateral soft wrist restraints. Which nursing action is most appropriate? 1. Perform circulation checks to bilateral upper extremities each shift. 2. Attach the ties of the restraints to the bed frame. 3. Reevaluate the need for restraints and document weekly. 4. Ensure the restraint order has been signed by the physician within 72 hours. The correct answer is 2. Restraints should be secured to the bed frame, not the side rails, to ensure that the side rails can be raised and lowered safely. Circulation checks, reevaluating need for restraints, and documentation should be done every 1 to 2 hours. Medical restraint prescriptions must be renewed and signed by a physician every 24 hours. Which of the following is an expected outcome for an elderly client following treatment for bacterial pneumonia? 1. A respiratory rate of 25 to 30 breaths per minute. 2. The ability to perform activities of daily living without dyspnea. 3. A maximum loss of 5 to 10 pounds of body weight. 4. Chest pain that is minimized by splinting the rib cage. The correct answer is 2. An expected outcome for a client recovering from pneumonia would be the ability to perform activities of daily living without experiencing dyspnea. A respiratory rate of 25 to 30 breaths per minute indicates the client is experiencing tachypnea, which would not be expected on recovery. A weight loss of 5 to 10 pounds is undesirable. The expected outcome would be to maintain normal weight. A client who is recovering from pneumonia should experience decreased or no chest pain. The client with pneumonia develops mild constipation, and the nurse administers docusate sodium as prescribed. This drug works by 1. Softening the stool. 2. Lubricating the stool. 3. Increasing stool bulk. 4. Stimulating peristalsis. The correct answer is 1. Docusate sodium is a stool softener that allows fluid and fatty substances to enter the stool and soften it. Docusate sodium does not lubricate the stool, increase stool bulk, or stimulate peristalsis. The nurse administers 2 325 milligrams aspirin every 4 hours to a client with pneumonia. The nurse should evaluate the outcome of administering the drug by assessing which of the following. Select all that apply. 1. Decrease pain when breathing. 2. Prolonged clotting time. 3. Decreased temperature. 4. Decreased respiratory rate. 5. Increased ability to expectorate secretions. The correct answers are 1 and 3. Aspirin is administered to clients with pneumonia because it is an analgesic that helps control chest discomfort and an antipyretic that helps reduce fever. Aspirin has an anticoagulant effect, but that is not the reason for prescribing it for a client with pneumonia, and the use of the drug will be short-term. Aspirin does not affect the respiratory rate and does not facilitate expectoration of secretions. A client with pneumonia is experiencing pleuritic chest pain. The nurse should assess the client for 1. A mild but constant aching in the chest. 2. Severe midsternal pain. 3. Moderate pain that worsens on inspiration. 4. Muscle spasm pain that accompanies coughing. The correct answer is 3. Chest pain in pneumonia is generally caused by friction between the pleural layers. It is more severe on inspiration than on expiration, secondary to chest wall movement. Pleuritic chest pain is usually described as sharp, not mild or aching. Pleuritic chest pain is not localized to the sternum, and it is not the result of a muscle spasm. Bed rest is prescribed for a client with pneumonia during the acute phase of the illness. The nurse should determine the effectiveness of bed rest by assessing clients. 1. Decreased cellular demand for oxygen. 2. Reduced episodes of coughing. 3. Diminished pain when breathing deeply. 4. Ability to expectorate secretions more easily. The correct answer is 1. Exudate in the alveoli interferes with ventilation and the diffusion of gases in clients with pneumonia. During the acute phase of the illness, it is essential to reduce the body's need for oxygen at the cellular level. Bed rest is the most effective method for doing so. Bed rest does not decrease coughing or promote clearance of secretions, and it does not reduce pain when taking deep breaths. Penicillin has been prescribed for a client admitted to the hospital for treatment of pneumonia. Prior to administering the first dose of penicillin, the nurse should ask the client, 1. Do you have a history of seizures? 2. Do you have any cardiac history? 3. Have you had any recent infections? 4. Have you had a previous allergy to penicillin? The correct answer is 4. The nurse should determine if the client is allergic to penicillin prior to administering the drug. History of seizures, recent infections, and a cardiac history are not contraindications for this client for receiving penicillin. While it is important to know, recent infections will not preclude this client receiving penicillin at this time. A client with bacterial pneumonia is to be started on IV antibiotics. Which of the following diagnostic tests must be completed before antibiotic therapy begins? 1. Urinalysis. 2. Sputum culture. 3. Chest radiograph. 4. Red blood cell count. The correct answer is 2. A sputum specimen is obtained for culture to determine the causative organism. After the organism is identified, an appropriate antibiotic can be prescribed. Beginning antibiotic therapy before obtaining the sputum specimen may alter the results of the test. Urinalysis, a chest radiograph, and a red blood cell count do not need to be obtained before initiation of antibiotic therapy for pneumonia. A 79-year-old client is admitted to the hospital with a diagnosis of bacterial pneumonia. While obtaining the client's health history, the nurse learns that the client has osteoarthritis, follows a vegetarian diet, and is very concerned with cleanliness. Which of the following would most likely be a predisposing factor for the diagnosis of pneumonia? 1. Age. 2. Osteoarthritis. 3. Vegetarian diet. 4. Daily bathing. The correct answer is 1. The client's age is a predisposing factor for pneumonia. Pneumonia is more common in elderly or debilitated clients. Other predisposing factors include smoking, upper respiratory tract infections, malnutrition, immunosuppression, and the presence of a chronic illness. Osteoarthritis, a nutritionally sound vegetarian diet, and frequent bathing are not predisposing factors for pneumonia. After teaching the parents of an 18-month-old who was treated for a foreign body obstruction about the 3 cardinal signs indicative of choking, the nurse determines that the teaching has been successful when the parents state that a child is choking when he or she cannot speak, turns blue, and does which of the following? 1. Vomits. 2. Gasps. 3. Gags. 4. Collapses. The correct answer is 4. The 3 cardinal signs indicating that a child is truly choking and requires immediate life-saving interventions include inability to speak, blue color, and collapse. Vomiting does not occur while a child is unable to breathe. Once the object is dislodged, however, vomiting may occur. Gasping, a sudden intake of air, indicates that the child is still able to inhale. When a child is choking, air is not being exchanged, so gagging will not occur. After teaching the parents of a toddler about commonly aspirated foods, which of the following foods, if identified by the parents as easily aspirated, would indicate the need for additional teaching? 1. Popcorn. 2. Raw vegetables. 3. Round candy. 4. Crackers. The correct answer is 4. Crackers, because they crumble and easily dissolve, are not commonly aspirated. Because children commonly eat popcorn hulls or pieces that have not popped, popcorn can be easily aspirated. Toddlers frequently do not chew their food well, making raw vegetables a commonly aspirated food. Round candy is often difficult to chew and comes in large pieces, making it easily aspirated. A toddler is scheduled to have tympanostomy tubes inserted. When approaching the toddler for the first time, which of the following should the nurse do? 1. Talk to the mother first so that the toddler can get used to the new person. 2. Hold the toddler so that the toddler becomes more comfortable. 3. Walk over and pick the toddler up right away so that the mother can relax. 4. Pick up the toddler and take the child to play area so that the mother can rest. The correct answer is 1. Toddlers should be approached slowly because they are wary of strangers and need time to get used to someone they do not know. The best approach is to ignore them initially and to focus on talking to the parents. The child will likely resist being held by a stranger, so the nurse should not pick up or hold the child until the child indicates a readiness to be approached or the mother indicates that it is okay. A nurse is teaching the parents of a preschooler about the possibility of postoperative hemorrhage after a tonsillectomy and adenoidectomy. The nurse should explain that the risk is greatest at which of the following times? 1. 1 to 3 days after surgery. 2. 4 to 6 days after surgery. 3. 7 to 10 days after surgery. 4. 11 to 14 days after surgery. The correct answer is 3. The risk of hemorrhage from a tonsillectomy is greatest when the tissue begins sloughing and the scabs fall off. This typically happens 7 to 10 days after a tonsillectomy. After a tonsillectomy and adenoidectomy, Which of the following findings should alert the nurse to suspect early hemorrhage in a 5-year-old child? 1. Drooling of bright red secretions. 2. Pulse rate of 95 beats per minute. 3. Vomiting of 25 milliliters of dark brown emesis. 4. Blood pressure of 95/56. The correct answer is 1. After a tonsillectomy and adenodectomy, drooling bright red blood is considered an early sign of hemorrhage. Often, because of discomfort in the throat, children tend to avoid swallowing. Instead, they drool. Frequent swallowing would also be an indication of hemorrhage because the child attempts to clear the airway of blood by swallowing. Secretions may be slightly blood-tinged because of a small amount of oozing after surgery. However, bright red secretions indicate bleeding. A pulse rate of 95 beats per minute is within the normal range for a 5-year-old child, as is a blood pressure of 95/56. A small amount of blood that is partially digested and therefore dark brown is often present in postoperative emesis. The nurse is inspecting the child's throat. The nurse should 1. Remove the tongue blade from the child's hands after he has experienced what it feels like in his mouth. 2. Ask the child to hold the tongue blade with both hands in his lap while the nurse uses another tongue blade. 3. Have the parent hold the child with arms restrained. 4. Guide the tongue blade while the child is holding it to depress the tongue to visualize the throat. The correct answer is 4. If the child does not stick out his tongue so the nurse can visualize the throat, it is appropriate to use a tongue blade. Having the child participate by holding the tongue blade while the nurse guides it to facilitate visualization of the throat is appropriate technique. It is not useful to remove the tongue blade or have the child hold it because the nurse will need to use the tongue blade to depress the tongue. It is preferable to engage the child's cooperation before asking the parent to restrain the child. The father of a 2-year-old phones the emergency room on a Sunday evening and informs the nurse that his son put a bead in his nose. What is the most appropriate recommendation made by the nurse? 1. Try to remove the bead at home as soon as possible. You might try using a pair of tweezers. 2. Be sure to take your child to the pediatrician in the morning so the pediatrician can remove the bead in the office. 3. You should bring your child to the emergency room tonight so the bead can be removed as soon as possible. 4. Ask your child to blow his nose several times. This should dislodge the bead. The correct answer is 3. The bead should be removed by a healthcare professional as soon as possible to prevent the risk of aspiration and tissue necrosis. Unskilled individuals should not attempt to remove an object from the nose as they may push the object further, increasing the risk for aspiration. 2-year-old children are not skilled at blowing their nose and may breathe in, further increasing the risk of aspiration. A toddler who has been treated for a foreign body aspiration begins to fuss and cry when the parents attempt to leave the hospital for an hour. The parents will be returning to take the toddler home. As the nurse tries to take the child out of the crib, the child pushes the nurse away. The nurse interprets this behavior as indicating separation anxiety, involving which of the following? 1. Protest. 2. Despair. 3. Regression. 4. Detachment. The correct answer is 1. Young children have specific reactions to separation and hospitalization. In the protest stage, the toddler physically and verbally attacks anyone who attempts to provide care. Here, the child is fussing and crying and visibly pushes the nurse away. In the despair stage, the toddler becomes withdrawn and obviously depressed. Regression is a return to a developmentally earlier phase because of stress or crisis. Denial or detachment occurs if the toddler's stay in the hospital without the parent is prolonged because the toddler settles into the hospital life and denies the parent's existence. After insertion of bilateral tympanostomy tubes in a toddler, which of the following instructions should the nurse include in the child's discharge plan for the parents? 1. Insert earplugs into the canals when the child bathes. 2. Blow the nose forcibly during a cold. 3. Administer the prescribed antibiotic while the tubes are in place. 4. Disregard any drainage from the ear after 1 week. The correct answer is 1. Placing earplugs in the ears will prevent contaminated bathwater from entering the middle ear through the tympanostomy tube and causing an infection. Blowing the nose forcibly during a cold causes organisms to ascend to the eustachian tube, possibly leading to otitis media. It is not necessary to administer antibiotics continuously to a child with a tympanostomy tube. Antibiotics are appropriate only when an ear infection is present. Drainage from the ear may be a sign of middle ear infection and should be reported to the healthcare provider. An adolescent female is prescribed amoxicillin, Amoxil, for an ear infection. The nurse should teach the adolescent about the risks associated with her concurrent use of 1. Antacids, 2. Oral contraceptives, 3. Multiple vitamins, 4. Protein shakes. The correct answer is 2. When a person is taking amoxicillin as well as an oral contraceptive, it renders the contraceptive less effective. Because pregnancy can occur in such a situation, the nurse should advise the client to use additional means of birth control during the time she is taking the antibiotic. There are no risks associated with the concurrent use of amoxicillin and antacids, vitamins, or protein shakes. After teaching the parents of a preschooler who has undergone a tonsillectomy and adenoidectomy about appropriate foods to give a child after discharge, which of the following is stated by the parents as appropriate foods, indicate successful teaching? 1. Meatloaf and uncooked carrots. 2. Pork and noodle casserole. 3. Cream of chicken soup and orange sherbet. 4. Hot dog and potato chips. The correct answer is 3. For the first few days after a tonsillectomy and adenoidectomy, liquids and soft foods are best tolerated by the child while the throat is sore. Children typically do not chew their food thoroughly, and solid foods are to be avoided because they are difficult to swallow. Although meatloaf would be considered a soft food, uncooked carrots would not be. Pork is frequently difficult to chew. Foods that have sharp edges, such as potato chips, are contraindicated because they are hard to chew and may cause more throat discomfort. The nurse has identified a problem of anxiety for a 4-year-old preparing for a tonsillectomy. The nurse should tell the child, 1. You won't have so many sore throats after your tonsils are removed. 2. The doctor will put you to sleep so you don't feel anything. 3. Show me how to get the doll an IV. 4. When it is done, you'll get to see your mommy and get a popsicle. The correct answer is 4. When preparing a child for a procedure, the nurse should use neutral words, focus on sensory experiences, and emphasize the positive aspects at the end. Being reunited with parents and having an ice pop will be considered pleasurable events. Children this age fear bodily harm. To reduce anxiety, the nurse should use the word fixed instead of removed to describe what is being done to the tonsils. Using the terms put to sleep and IV may be threatening. Additionally, directing a play experience to focus on IV insertion may be counterproductive as the child may have little recollection of this aspect of the procedure. A multigravida client who stands for long periods while working in a factory visits the prenatal clinic at 35 weeks gestation, stating, "The varicose veins in my legs have really been bothering me lately. Which of the following instructions would be helpful? 1. Perform slow contraction and relaxation of the feet and ankles twice daily. 2. Take frequent rest periods with the legs elevated above the hips. 3. Avoid support hose that reach above the leg varicosities. 4. Take a leave of absence from your job to avoid prolonged standing." The correct answer is 2. The client with leg varicosities should take frequent rest periods with the legs elevated above the hips to promote venous circulation. The client should avoid constrictive clothing, but support hose that reach above the varicosities may help alleviate the pain. Contracting and relaxing the feet and ankles twice daily is not helpful because it does not promote circulation. Taking a leave of absence from work may not be possible because of economic reasons. The client should try to rest with her legs elevated or walk around for a few minutes every 2 hours while on the job. On entering the room of a client who has undergone a dilatation and curettage for spontaneous abortion, the nurse finds the client crying. Which of the following comments by the nurse would be most appropriate? 1. Are you having a great deal of uterine pain? 2. Commonly spontaneous abortion means a defective embryo. 3. I'm truly sorry you lost your baby. 4. You should try to get pregnant again as soon as possible. The correct answer is 3. The death of a fetus at any time during pregnancy is a tragedy for most parents. After a spontaneous abortion, the client and family members can be expected to suffer from grief for several months or longer. When offering support, a simple statement such as, "I'm truly sorry you lost your baby," is most appropriate. Therapeutic communication techniques help the client and family understand the meaning of the loss, move less stressfully through the grief process, and share feelings. Asking the client whether she is experiencing a great deal of uterine pain is inappropriate because this is a yes or no question and doesn't allow the client to express her feelings. Saying that the embryo was defective is inappropriate because this may lead the client to think that she contributed to the fetus's demise. This is not the appropriate time to discuss embryonic or fetal malformations. However, the nurse should explain to the client that this situation was not her fault. Telling the client that she should get pregnant again as soon as possible is not therapeutic and discounts the feelings of the expectant mother who had already begun to bond with the fetus. A dilatation and curettage is scheduled for a premigravida client admitted to the hospital at 10 weeks gestation with abdominal cramping, bright red vaginal spotting, and passage of some of the product of conception. The nurse should assess the client further for the expression of which of the following feelings? 1. Ambivalence. 2. Anxiety. 3. Fear. 4. Guilt. The correct answer is 4. With a spontaneous abortion, many clients and their partners feel an acute sense of loss. Their grieving commonly includes feelings of guilt, which may be expressed as wondering whether the woman could have done something to prevent the loss. Anger, sadness, and disappointment are also common emotions after a pregnancy loss. Ambivalence, anxiety, and fear are not common emotions after a spontaneous abortion. A 40-year-old client at 8 weeks gestation has a 3-year-old child with Down syndrome. The nurse is discussing amniocentesis and chorionic villus, sampling as genetic screening methods for the expected baby. The nurse is confident that the teaching has been understood when the client states which of the following? 1. Each test identifies a different part of the infant's genetic makeup. 2. Chorionic villus sampling can be performed earlier in pregnancy. 3. The test results take the same length of time to be completed. 4. Amniocentesis is a more dangerous procedure for the fetus. The correct answer is 2. Chorionic villus sampling can be performed from approximately 8 to 12 weeks gestation, while amniocentesis cannot be performed until between 11 weeks gestation and the end of the pregnancy. 11 weeks gestation is the earliest possible time within the pregnancy to obtain a sufficient amount of amniotic fluid to sample. Because CVS take a piece of membrane surrounding the infant, this procedure can be completed earlier in the pregnancy. Amniocentesis and chorionic villus sampling identify the genetic makeup of the fetus in its entirety, rather than a portion of it. Laboratory analysis of chorionic villus sampling takes less time to complete. Both procedures place the fetus at risk, and post-procedure teaching asks the client to report the same complicating events, such as bleeding, cramping, fever, and fluid leakage from the vagina. A woman at 22 weeks gestation has right upper quadrant pain radiating to her back. She rates the pain as 9 on a scale of 1 to 10 and says that it has occurred 2 times in the last week for about 4 hours at a time. She does not associate the pain with food. Which of the following nursing measures is the highest priority for this client? 1. Educate the client concerning changes occurring in the gallbladder as a result of pregnancy. 2. Refer the client to her healthcare provider for evaluation and treatment of the pain. 3. Discuss nutritional strategies to decrease the possibility of heartburn. 4. Support the client's use of acetaminophen to relieve pain. The correct answer is 2. The nurse seeing this client should refer her to a healthcare provider for further evaluation of the pain. This referral would allow a more definitive diagnosis and medical interventions that may include surgery. Referral would occur because of her high pain rating, as well as the other symptoms. which suggests gallbladder disease. During pregnancy, the gallbladder is under the influence of progesterone, which is a smooth muscle relaxant. Because bile does not move through the system as quickly during pregnancy, bile stasis and gallstone formation can occur. Although education should be a continuous strategy, with pain at this level, a brief explanation is most appropriate. Major emphasis should be placed on determining the cause and treating the pain. It is not appropriate for the nurse to diagnose pain at this level as heartburn. Discussing nutritional strategies to prevent heartburn are appropriate during pregnancy, but not in this situation. Tylenol is an acceptable medication to take during pregnancy, but should not be used on a regular basis, as it can mask other problems. A preemie gravida client has completed her first prenatal visit and blood work. Her laboratory test for the hepatitis B surface antigen is positive. The nurse can advise the client that the plan of care for this newborn will include which of the following? Select all that apply. 1. Hepatitis B immune globulin at birth. 2. Series of 3 hepatitis B vaccinations per recommended schedule. 3. Hepatitis B screening when born. 4. Isolation of infant during hospitalization. 5. Universal precautions for mother and infant. 6. Contraindication for breastfeeding. The correct answers are 1, 2, and 5. The test result indicates that the mother has an active hepatitis infection and is a carrier. Hepatitis B immune globulin at birth provides the infant with passive immunity against hepatitis B and serves as a prophylactic treatment. Additionally, the infant will be started on the vaccine series of 3 injections. The infant should not be screened or isolated because the infant is already hepatitis B positive. As with all clients, universal precautions should be used and are sufficient to prevent transmission of the virus. Women who are positive for hepatitis B surface antigen are able to breastfeed. A multigravida client at 32 weeks gestation has experienced hemolytic disease of the newborn in a previous pregnancy. The nurse should prepare the client for frequent antibody titer evaluations obtained from which of the following? 1. Placental blood. 2. Amniotic fluid. 3. Fetal blood. 4. Maternal blood. The correct answer is 4. For the Rh-negative client who may be pregnant with an Rh-positive fetus, an indirect Coombs test measures antibodies in the maternal blood. Titers should be performed monthly during the first and second trimesters, and biweekly during the third trimester and the week before the due date. While caring for a 24-year-old preemie gravida client scheduled for emergency surgery because of a probable ectopic pregnancy, the nurse should 1. Prepare to witness and inform consent for surgery. 2. Assess the client for massive external bleeding. 3. Explain that the fallopian tube can be salvaged. 4. Monitor the client for uterine contractions. The correct answer is 1. The client may need surgery to remove a ruptured fallopian tube where the pregnancy has occurred, and the nurse is usually responsible for witnessing the signature on informed consent. Typically, if bleeding is occurring, it is internal, and there is only scant vaginal bleeding with no discoloration. The nurse cannot determine whether the fallopian tube can be salvaged. This can be accomplished only during surgery. If the tube has ruptured, it must be removed. If the tube has not ruptured, a linear salpingostomy may be done to salvage the tube for future pregnancies. With an ectopic pregnancy, although the client is experiencing abdominal pain, she is not having uterine contractions. RhoGAM is prescribed for a client before she is discharged after spontaneous abortion. The nurse instructs the client that this drug is used to prevent which of the following? 1. Development of a future Rh-positive fetus. 2. An antibody response to Rh-negative blood. 3. A future pregnancy resulting in abortion. 4. Development of Rh-positive antibodies. The correct answer is 4. Rh sensitization can be prevented by RhoGAM, which clears the maternal circulation of Rh-positive cells before sensitization can occur, thereby blocking maternal antibody production to Rh-positive cells. Administration of this drug will not prevent future Rh-positive fetuses, nor will it prevent future abortions. An antibody response will not occur to Rh-negative cells. Rh-negative mothers do not develop sensitivities if the fetus is also Rh-negative. When providing care to the client who has undergone a dilatation and curettage after a spontaneous abortion, the nurse administers hydroxyzine as prescribed. Which of the following is an expected outcome? 1. Absence of nausea. 2. Minimized pain. 3. Decreased uterine cramping. 4. Improved uterine contractility. The correct answer is 1. Hydroxyzine has a tranquilizing effect and also decreases nausea and vomiting. It does not decrease fluid retention, reduce pain, decrease uterine cramping, or promote uterine contractility. One of the adverse effects of the medication is sleepiness. Ibuprofen may decrease pain from uterine cramping. Oxytocin may be used to increase uterine contractility. After conducting a presentation to a group of adolescent parents on the topic of adolescent pregnancy, the nurse determines that one of the parents needs further instruction when the parent says that adolescents are at greater risk for which of the following? 1. Denial of the pregnancy. 2. Low birth weight infant. 3. Cephalopelvic disproportion. 4. Congenital anomalies. The correct answer is 4. Additional teaching is needed when the parent says that adolescents are at greater risk for congenital anomalies. Although adolescents are at greater risk for denial of the pregnancy, lack of prenatal care, low birth weight infant, cephalopelvic disproportion, anemia, and nutritional deficits, and have a higher maternal mortality rate, studies reveal that congenital anomalies are not more common in adolescent pregnancies. A client in the triage area, who is at 19 weeks gestation, states that she has not felt her baby move in the past week, and no fetal heart tones are found. While evaluating this client, the nurse identifies her as being at the highest risk for developing which problem? 1. Abruptio placentae. 2. Placenta previa. 3. Disseminated intravascular coagulation. 4. Threatened abortion. The correct answer is 3. A fetus that has died and is retained in utero places the mother at risk for disseminated intravascular coagulation because the clotting factors within the maternal system are consumed when the non-viable fetus is retained. The longer the fetus is retained in utero, the greater the risk of DIC. This client has no risk factors, history, or signs and symptoms that put her at risk for either abruptio placentae or placenta previa, such as sharp pain and woody, firm consistency of the abdomen, or painless bright red vaginal bleeding. There is no evidence that she is threatening to abort, as she has no cramping or vaginal bleeding. A woman with asthma controlled through consistent use of medication is now pregnant for the first time. Which of the following client statements concerning asthma during pregnancy indicates the need for further instruction? 1. I need to continue taking my asthma medication as prescribed. 2. It is my goal to prevent or limit asthma attacks. 3. During an asthma attack, oxygen needs to continue to be high for mother and fetus. 4. Bronchodilators should be used only when necessary because of the risk they present to the fetus. The correct answer is 4. Asthma medications and bronchodilators should be continued during pregnancy as prescribed before the pregnancy began. The medications do not cause harm to the mother or fetus. Regular use of asthma medication will usually prevent asthma attacks. Prevention and limitation of an asthma attack is the goal of care for a client who is or is not pregnant and is the appropriate care strategy. During an asthma attack, oxygen needs to continue as with any pregnant client, but the airways are edematous, decreasing perfusion. Asthma exacerbations during pregnancy may occur as a result of infrequent use of medication rather than as a result of the pregnancy. A client with a past medical history of ventricular septal defect repaired in infancy is seen at the prenatal clinic. She has dyspnea with exertion and is very tired. Her vital signs are temperature, 98.0 degrees Fahrenheit, pulse, 80 beats per minute, respiration, 20 breaths per minute, and blood pressure 116/72. She has +2 pedal edema and clear breath sounds. As the nurse plans this client's care, which of the following is her cardiac functional classification? 1. Class 1. 2. Class 2. 3. Class 3. 4. Class 4. The correct answer is 2. According to both the New York Heart Association and the Canadian Cardiovascular Society, this client would fit under Class 2 because she is symptomatic with increased activity, which is dyspnea with exertion. Class 2 clients have cardiac disease and a slight limitation in physical activity. When physical activity occurs, the client may experience angina, difficulty breathing, palpitations, and fatigue. All of the client's other symptoms are within normal limits. A client states to a nurse, "Hey, sweetie, you're looking good today." Which of the following responses by the nurse is best? 1. Thank you for being so kind and thoughtful. 2. I know you are only teasing me. 3. My name is Molly and I am a nurse on a unit today. 4. I am not here to receive compliments from clients. The correct answer is 3. The nurse states her identity and purpose for being on the unit to clarify any misperception by the client. Thank you for being so kind. I know you are only teasing me, and I am not here to receive compliment from clients are non-therapeutic statements and do not clarify the nurse's identity and purpose. The client with acute mania has been admitted to the inpatient unit voluntarily. The nurse approaches the client with medication to be taken orally as prescribed by the primary health care provider. The client states, "I don't need that stuff," which responds by the nurse is best. 1. You can't refuse to take this medication. 2. If you don't take it orally, I'll give you a shot. 3. The medication will help you feel calmer. 4. I'll get you some written information about the medication. The correct answer is 3. The nurse should first attempt a collaborative approach to increasing adherence to prescribed medication regimen. Giving written medication information to a client with acute mania is poor nursing judgment, because a client with acute mania cannot benefit from written information as a result of impaired ability to focus and concentrate. A healthcare provider has prescribed valproic acid for a client with bipolar disorder who has achieved limited success with lithium carbonate. The nurse should instruct the client about which of the following? 1. Follow-up blood tests are necessary while on this medication. 2. The extended release tablet can be crushed if necessary for ease of swallowing. 3. Tachycardia and upset stomach are common side effects. 4. Consumption of a moderate amount of alcohol is safe if the medication is taken in the morning. The correct answer is 1. Valproic acid can cause hepatotoxicity, so regular liver function tests are needed. Other side effects include nausea and drowsiness. Extended release tablets should not be split or crushed. Doing so changes their absorption. Alcohol should never be mixed with this medication. There will be medication in the client's body at all times. A client has just been admitted to the hospital for medication adjustment after outpatient treatment failure of his bipolar disorder and returning mania. He tells his primary nurse about his medications and treatment. Which of his following statements would raise the most urgent need for more medication instruction about his lithium therapy? 1. My doctor tells me that my lithium level is 1.0, so I don't have to worry about my levels. 2. I've been getting a lot of good exercise playing on a local soccer team. 3. I'm trying hard to watch my diet and eat healthy. 4. I have learned to take my lithium even when I'm not feeling well, like when I had the stomach flu. The correct answer is 4. The therapeutic serum level for lithium is 0.6 to 1.2 milliequivalents per liter. Levels do fluctuate with fluid intake and output, however. Therefore, the most urgent matter for teaching is the client's comment about taking his lithium during excessive loss of fluids during an episode of stomach flu with diarrhea. Exercising is only concerning if the client becomes dehydrated. A healthy diet is indicated while taking lithium. A client comes to a mental health clinic saying that he feels so down and lacking in energy with loss of interest in everything. He tells the nurse that he received some samples of a new medication from his primary care physician last week to relieve his depression. The nurse recalls that this client has a history of bipolar 1 disorder with hospitalization for a significant manic episode. With this knowledge, the nurse would have special concern if he is taking which of the following categories of medication? 1. atypical antipsychotics. 2. Mood stabilizers / animatics. 3. Anti-anxiety agents. 4. Selective serotonin reuptake inhibitor antidepressant. The correct answer is 4. The most urgent consideration for intervention and for teaching is the fact that for individuals with a history of bipolar disorder, antidepressants, when taken alone, can push the person into mania. Antipsychotics are sometimes prescribed for clients with bipolar disorder and would not pose a special concern. Individuals with bipolar disorder are typically treated with mood stabilizers, and benzodiazepines are sometimes used in the short term to give a client relief before the mood stabilizers can take effect. A client with acute mania fails to respond to a nurse's interventions to decrease his agitation. The nurse has attempted to defuse the client's anger, but the client refuses to participate in interventions that would lower anxiety. Which action should the nurse take next? 1. Seclude the client. 2. Restrain the client. 3. Medicate the client. 4. Control the client. The correct answer is 3. The nurse should medicate the client who does not respond to verbal interventions and whose anxiety is escalating. This will reduce the client's anxiety and agitation and prevent harm or injury to the client and others. Seclusion, restraint, and controlling the client are a last resort and require a primary health care provider prescription and close assessment for when the prescriptions can be discontinued. A nurse observes a male client who is hyperactive and intrusive, sitting very close to a female client with his arm around her shoulders. The nurse hears the male client tell an inappropriate joke. The nurse approaches the client and asks him to walk down the hallway. Which of the following statements by the nurse should benefit the client? 1. She will not want to be around you with that kind of talk. 2. Telling inappropriate jokes and touching others is not permitted here. 3. You need to be careful about what you say to other people. 4. I think a timeout in your room would be appropriate now. The correct answer is 2. The nurse clearly informs the client about behavior that is unacceptable on the unit, such as voicing inappropriate jokes and touching others. Setting limits on behavior provides safety and security to the client and conveys to the client that he is worthy of help. Saying, she will not want to be around you with that kind of talk, and you need to be careful about what you say to others, does not clearly inform the client about behaviors that are unacceptable and implies that the client can control behaviors if he chooses. A timeout in the client's room does not inform the client about the inappropriateness of his behaviors and could be interpreted by the client as punitive as well as diminishing his self-esteem. A young adult client diagnosed with bipolar disorder has been managing disorder effectively with medication and treatment for several years. The client suddenly becomes manic. The nurse reviews the client's medication record. Which of the following medications may have contributed to the development of his manic state? 1. Amitriptyline. 2. Prednisone. 3. Buspirone. 4. Gabapentin. The correct answer is 2. The use of prednisone or other steroids can initiate a manic state in a bipolar client, even if he is well controlled on medication. The other medications would decrease the client's depression, mood swings, and anxiety, making him calmer rather than more agitated. A young woman comes to the mental health clinic for her routine medication follow-up. She has been married for 2 years and reports that she and her husband are ready to start a family. She has a diagnosis of bipolar 1 disorder and has been well managed on D-valproic sodium, Depakote, for at least 3 years. What is the most essential counsel for the nurse to give her? 1. Schedule an appointment for a complete gynecological exam if you have not had one in the past year. 2. Pay careful attention to eating healthy from this point on in order to maximize the health of both mother and baby. 3. Check with your prescriber today as Depakote carries an increased risk for birth defects, especially during the first 3 months of pregnancy. 4. It is very important for you to take steps to reduce your stress, and this will help you to stay in balance during your pregnancy and reduce your chances of developing postpartum depression. The correct answer is 3. All of these options need to be addressed. However, it is vital that this young woman receive counseling about the serious birth defects that have an increased incidence with the taking of Depakote. during the first trimester of pregnancy. These problems include craniofacial abnormalities, organ malformations, limb deficiencies, and developmental delays. The chances of preeclampsia and premature labor are also increased. In a pre-discharge program to educate clients with bipolar disorder and their family members, the nurse emphasizes that the most significant indicators for the onset of relapse include which of the following symptoms? 1. A sense of pleasure and motivation for new endeavors. 2. Decreased need for sleep and racing thoughts. 3. Self-concern about increase in energy. 4. Leaving a good job to start a new business. The correct answer is 2. Decreased need for sleep and racing thoughts are the most prominent hallmarks of mania. Feelings of pleasure, motivation, and increased energy within reason are desired experiences. Also, leaving a job to start a new business is not, in itself, a sign of impending illness.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.